Welcome everyone. In our midst, we have a great nurse by name Olayinka O Aremu, all the way from Trinity College, Ireland. Okay, thank you, colleague. It's a pleasure having you in our midst. Please, can you?
It's a pleasure too.
Thank you so much. Can you please tell us about yourself?
So, good evening, good day, good evening, good afternoon, whatever time it is, everyone. My name is Olayinka O Aremu, as Dr. Precious has rightly mentioned. I'm right here from Ireland. I'm originally from Nigeria, resident in Ireland, and I'm currently doing my Ph.D. in the Trinity College, Dublin in Ireland, just my first year. So you asked me about a bit of myself. So like I said,
Yes.
I'm originally from Nigeria, now in Ireland. I work presently as a clinical nurse manager in a residential care facility in Dublin here. I've had quite experience from Nigeria to Ireland. Has been kind of a major experience for me, the journey. The transition from Nigeria to Ireland was a big one. Thankful to God. So I had my master's back in Nigeria. So my Ph.D, my master's program was in the Obafemi Awolowo University, Ile-Ife. And I had my master's in the community nursing specialty, where I actually focused on the sexual and reproductive health care of the out of school adolescents, actually. But migrating to Ireland, there was a major shift for me, where I kind of more practice and experience in care of the older persons. So at the moment, my PhD, it's on the care of the older person. I'm focusing on care of the older persons with particular interest in the care transition of the older persons. So I'm trying to bring the gap between the community setting and the hospital setting to see how we can, ensure smooth and efficient care transition for the older people when they leave the hospital or when they go back to the community. Most of them want to go to their home or even in the rehab center or nursing home. So ensuring that smooth transition and ways to improve on that are what I'm focusing on for my PhD. So that's a bit about myself. Thank you for having me.
You're welcome. This is really amazing. You must be experienced, and also you must have a lot of things to tell us about caring presence. Nice having you.
Well, I'll try my best. I'll try my best. Yeah.
That's great. Okay, quickly, kindly tell us about your views on caring presence.
So when Dr. Precious yourself, when you share this topic with me and this link, I was like, okay, what does he want me to say? Caring presence. I've heard about caring presence, especially from, I think one of my colleagues then during masters did at thesis or a seminar work on caring presence. So that kind of gave me a reflection back on what it was. So as a nurse, I know my own understanding or an experience of a caring presence is that nature that is inherent in nursing. So if we're going to break caring presence to caring and presence, so there are two different words, but in this sense, we are looking at it together as a whole, caring presence. But then let's split it out and see what it means for every layman person or somebody that is not in nursing to really understand what we mean by caring presence. So I believe that caring is an inherent nature of nursing. So you can't be in nursing without being caring. It's like that image that nurses carry. So that's the image. Everybody that sees you are a nurse, they expect you to be caring. That's the image of nursing. Caring is an image of nursing. Now, talking about presence, for you to know, like, oh, there's a presence, there's an awareness. So presence really mean like an awareness of your environment, an awareness of what happens around you, or awareness of, it's majorly awareness, that realization of what is happening or what is going to happen. So bringing these two together, I figure like caring presence is the awareness of the caring nature of nursing, particularly when it comes to the care of the people we look after, old or young, male or female, black or white, irrespective of the color, irrespective of the gender. So it's that awareness of our caring nature, our caring attitude about those we care about. And this it's dynamic, it's elaborate. Like, we can't stop talking about it. We can't finish talking about it today. What it means, what caring presence means. Actually, I haven't done a big research. I'm sure you've done a lot of research on it, Dr. Precious. I've not done research on it, but reflecting on my practice as a nurse, I can bring out loads of ways that caring presence is essential in nursing practice and even in healthcare practice generally. So I think I'll pause there.
Thank you. Okay. Yeah, I think you get to know more about, you said something about reflecting in your practice. Can you share from your experience or someone close to you who has practiced presence? Can you tell us more about it?
Yeah, thank you so much for that. Like I said, at the moment, my focus or my area of interest is the care of the older person. So I'm really going to be talking about caring presence in the perspective of the care of the older people, because that's what I do now. So if you permit me to rephrase the topic of discussion to be caring presence in the care of the older people. And I'll also try to see how we can discuss, actually talk about the influence of COVID-19 in the caring presence. What role has COVID-19 played in caring presence, especially when it comes to the care of the older people. So like I said, I'm a clinical nurse manager, but I didn't get here just in a twinkling of an eye. It was like a process. I started from a staff nurse working in a nursing home. And for the older people themselves, they're just like babies. Like, they need people to do things for them. They most of the time, especially those that live with dementia, they're not aware of their environment. So we as nurses, we as healthcare professionals, we are like their presence. We are the one that can define that presence for them, that can define their environment for them. So time in and time out, as a nurse, as a clinician working with older people, I've experienced presence, caring presence in all my practices, because you can't take it away from your practice. We particular focus on older people. So for older people, their environment matters a lot. I work in a nursing home where we try to make the place like home away from home. So making that environment conducive, similar to what they are used to, what they normally like, even their room, you have to adapt it. So you have to adapt it so that they can have that presence, like I'm at home, I'm in my house. So get their pictures around them, hold pictures from their families. If they love music, play the kind of music they love. If they love a particular portrait picture, put it in their room, things like that. If they love their room to be painted in a particular color, so we'll make sure that we get that paintings for them, that color. So that's presence, but it's actually more than that. So caring presence, like what we practice every day, what I have practiced every day, it starts with active listening, because you cannot say you are present when you don't listen. And, most of these older people, they want somebody, just, the loneliness and all that, the boredomness and all that. They want somebody to listen to them. Now, if you bring it to the aspect of people that have dementia, that's another level, because they are not aware of the environment. So you have to be present as a nurse. You can't be half there and then you're thinking about other things. Fine, we have our personal life, which is kind of challenging to us as healthcare professionals. How do you find that balance? How do you, define that definition of this is my own life issues? I shouldn't bring it to work. Now I have to assume the role of that caring nurse. You know what I mean? So it's a very thin line, but then that is why we are nurses. That is our job. So we really need to be able to, bring our whole self into our workplace. That is bringing your caring presence into your workplace. You can't say you care for someone and then you are not wholly there. So your mind, your body, everything has to be there. Otherwise, like, there will be room for mistakes, there will be room for errors, there will be room for missing care, which is another, like, when there is no caring presence, there's going to be missing care. You understand what I mean? A lot of missing care. So if you are not present, you're going to miss out in your caring attitude, your caring role to your patient. So have experienced this several times, every day, especially with the older people. You have to be actively listening to them. You have to, show them that you are concerned about them, talk to them. That effective communication. And like I mentioned about the environment also matters, adapting their environment to suit them. It matters. I think I pulled down something there because I like to write a lot, don't mind me. One other thing about caring presence, especially in the sense of the older people, is it continues even after hospital discharge. Remember, I told you that I'm working on care transition of older people. So our caring presence does not just end with hospital admission and, when the patient is being discharged. Most of these older people, they are discharged either to their home or they are discharged to a nursing home or to a rehabilitation unit and all that. So our caring presence as nurses should continue. So that doesn't mean that you have to leave your workplace and go to the other units to function. That's the essence of efficient care transition, handover, discharge communication. So I did like a journal, what I call a review about discharge communications when it comes to the care of the other people. That's still about carrying our caring presence along when you are discharging the patient. So it continues. It, like we say, there's that continuity of care that has to be there. So either through follow-up care, or home visits, telephone call, there are several ways we could, continue care even after discharge. So, and that's the presence. Actually, that's the presence. So, to summarize this, I know you still have a lot of questions. is that caring presence in nursing for myself and for some other colleagues that work with this, something we do every day. Even though most of the time we don't, attach meaning to what we do. That's something about us is our care might not be so measurable. Thankfully, there are a lot of measures now put in place to see how we can measure nursing care. Where I used to work in the Mater Hospital, they started a caring bundle. So like that's the care model. That's what we use now for handovers, for your write-up. You need to show that you are present. How do you show that you have thank you again. Thank you for, I lost you there. So talking about our caring presence as nurses, and now it is being recorded because that's not something that has been missing for a long time in nursing, measuring our care.
Yes.
How do we measure the care that we provide? We are present as nurses. We are always there for this patient, but how do we, measure these things? And there's this caring model now that is on and people are adopting it. It's been adopted where I used to work in the Mater. Caring model that's all your handovers, all your documentation has to be in, you have to use that caring model. Like, how do you show that you offer, personal hygiene to a patient? How do you show that you offer toileting it? You help a patient with toileting it. You help them to meet their, their hydration needs and all that. So all these things are major. These are the things we do on a daily basis. So as a nurse, there's no nurse that will not practice a caring presence. It's just being aware and being conscious of the fact that this is what I'm doing and have to do it right.
Yes.
So, this is what so we are being trained. We are being that's part of our experience to be there, to be present when we care for people. Like caring and presence, they go parallel.
Okay.
So if you are caring, you have to be present. You can't be caring without being present.
Okay.
So they are going parallel. They go together. So if as nurses we are caring for our patient as we do every day, even as a nurse manager now, like I used to tell my colleagues that I'm caring for the resident, I'm caring for my staffs, I'm caring for the family, I'm also caring for the management because we are
Yes.
managing the management. So the presence has to be there. You have to
Okay.
be able to function 100% for you to have that, that proper caring presence.
Yes.
Yeah. So it's something very, very important that we need to be aware of. And I'm going to encourage every nurses how they actually to be aware of their presence.
Okay. In
Where they work.
practice.
In
Yes.
practice, yes. So we're not just going there for the salary or, just to get paid.
Okay.
Most of the time we just come, oh, okay, I'll resume at 8 o'clock. And then we start counting hours. When am I finishing? When am I finishing? So, of course, you have to finish. You have to go back to your family. You have to go back home. But within the time, you are using 5 hours in your place of work. That 5 hours, is it really like productive?
Okay.
You understand what I mean?
Okay. Yes.
Productive in the sense that do you have your presence there?
Yes.
Because it goes a long way. It's going to affect your documentation. It's going to affect the care you render, actually.
Yes.
And this patient, this resident, they know if you are present or not.
Yes.
They'll be able to tell, like, oh, that nurse was brilliant. That nurse was, oh, he was there for me. He was listening. Oh, they know.
Yes.
So if you have actually carried out any care and the recipient does not feel what you have done, then I don't think you have done any caring at the, like, you understand what I mean? So
yes.
There has to be that feedback from the other side. Either they can talk, either they're demented or not. They should be able to feel your presence.
Yes.
As a nurse.
That's so very amazing.
Yeah. Thank you.
Okay, thank you so much. Thank you so much. But do you really think nurses practice presence that much?
Well, I can compare, I can contrast. There are a lot of factors that could affect our caring presence as nurses. So many factors.
Okay.
Sometimes the workload also matters.
Yes.
So, like I said, you come in the morning, 8 o'clock, you resume half 8, you hand over, and then you already see what you have to do. Maybe you have like 20 patient caseload, one nurse. How do you want to be present for 20 patients? Like, it's not proper, like it's not realistic.
Yes.
So I won't say nurses don't practice caring presence. It depends on a lot of factors. When the right system is in place, the right factors, like every enabling environment is in place, we will be able to practice like the nursing presence. It's inherent in us, like it's part of our training, it's part of our professionalism and all that to be present. But then so many factors can hinder it.
Oh, thank you so much. Okay, now as a nurse, how do you feel when you practice presence?
It's that fulfillment. That's like that satisfaction that comes, like I've been able to touch a life, I've been able to do something tangible to somebody, especially when it comes to feedback, when it comes to with feedback. When you have a patient tell you like, oh, thank you so much, you're so good, that's kind word. You feel elated yourself, you feel happy, like I've done a good job. Like that. So it actually comes with fulfillment and satisfaction.
That's interesting to hear.
Yeah.
Okay, thank you so much, Nurse Olayinka. Okay, the COVID pandemic has really done a lot in the world.
Yeah.
So can you say one or two words of encouragement to the nurses?
Okay, I was actually going to say this, but thank God you mentioned it, like COVID-19 and caring presence.
Okay.
I'm going to be talking about this in the perspective of the older people that I care for.
Okay.
So when COVID came, we all know how the whole thing was. You have to gown, you have to mask. Like, I was in the emergency unit then, and what we have to do is, even the patient will not recognize who is coming.
No.
You understand? So we had to get a badge to put our picture on the PPE, the scrub and all that.
Yes.
So the presence we are talking about, it still has to do with our physical presence, even though emotional presence is also included, like
Yes.
your mental stability, but then the physical presence is important.
Yes.
So nurses are known to smile a lot. Like if there is a nurse that doesn't smile, then that person should not be in nursing, But when you can't even show that you're smiling with mask on your face, that is something that COVID-19 has done to us. So you have to be smiling with your eyes, or you have to say it verbally, like, I'm smiling. So the
Okay.
patient knows that you're smiling to him or her.
Yes.
You know what I mean? So COVID-19 has really affected the caring presence, especially when it comes to physically and also mentally, because everybody is exhausted.
Yeah.
Everybody is exhausted. So you won't be able to, function like that's your maximum presence will not be there. So, but thankfully, like with the vaccine and everything, like things are coming around, and we can actually start practicing our caring presence as time goes on, hopefully.
Okay. That's quite interesting. Okay. Okay, maybe you can just tell the nurses out there something regarding this COVID pandemic, how they like just one or two words of encouragement as I mentioned before.
Yeah. Okay. Yeah, thank you. That's actually very necessary. First of all, as nurses, we know we are back in Nigeria. We used to improvise a lot. Like we have to adapt the environment.
Yes.
We have to be creative with our thinking on how can I improve on my caring presence, even though COVID-19 is around the corner. Okay, even though there are social distancing rules, policies, and all that, how can we? So we really need to be able to think outside the box of what we can. So at the moment where I work, like when the COVID was still like really, really bad, we still encourage activity, socialization within the home so that the patients are not bored.
Okay.
You know that the artistic touch is also very important, even though you're wearing your gloves. You're still there for them. You still, like I said, we have to wear a badge to write our names, put our picture there, and do like a smiley, just to smile, that emoji thing, like I'm smiling to you. It's just being creative with our approach to life, with our approach to caring for people, especially, like I said, in my perspective of the older people. It's very important. So I'm going to say to other nurses out there, we need to be aware of our environment. How can you adapt your environment, the environment of your patient, to suit their needs, to show that you are there for them? Of late, one of my residents was an end of life care, and we had to go and bring like pictures, memories, for the patient to just reflect on, even as we know that's his end of life care. So it was really appreciated. The family was so happy, like we could talk about that. It was like a happy ending kind of thing, So it's just being creative, being innovative, and thinking outside the box. So we should not be so used to the routine way of doing things. I hate the routine. One thing I hate routine. So just think and see how can I make things better, rather than sticking to the old ways of doing things. Okay, so now COVID is there. What are you going to do? We have to look for ways to still continue our caring presence, So that's my encouragement to all the nurses. Thank you.
Thank you so much. Thank you so much.
Thank you, Dr. Chris.
Your words are really enriching. Okay, thank you. Would you mind if you have any project you're working on? You can tell us about the project or
well, I have a lot of things I'm working on.
Okay.
Like I told you, for my thesis, I'm working on improving the care transition experiences of older people.
Okay.
So that's still in the pipeline. So if there are anyone that is interested or that has resources or articles that will be of good to me, please forward it to me. Like they could get my email from you, so you can tell them. As well, part of caring presence is also caring for other healthcare workers. So for me personally, I have a network of African nurses where we provide support to African immigrants, because if we are not mentally stable, if we are not, well, you can't provide that ultimate care. That's caring presence that we're talking about. So that's one thing I do as well. amongst other things.
Okay, thank you so much. Thank you for everything. It's really
Thank you, Dr.
interesting having you, and wish you the best in your studies and also your work.
Thank you.
Be
I hope I'll
confident and stay
connect with you
safe.
soon.
Okay,
Let me
thank you
come
so
and
much.
the words of experience.
Yeah. Okay, it's fine.